all over the world. Brain death was used as an excuse to get rid of organs of people who are not ready. There is no external force involved. There is no agent from outside getting involved in this. This was clear murder by the doctor.
In 2009, an 18-year-old young man named Abin met with an accident in Kerala's Ernakulam district. He was rushed to Mar Basilios Hospital in Kodamangalam, and the next day he was referred to Lakeshore Hospital in Kochi. Just 2 days later his accident, he was declared brain dead by the doctors of Lakeshore Hospital. Now it has come into light that a crucial test to declare whether Abin was brain dead was not done by the authorities of Lakeshore Hospital. Joining us, Dr. S. Ganapathy, incidentally is a true whistleblower in the case.
Yes, thank you.
Sir, Abin died in 2009. So, when did you get involved in this case? And the newspaper report was the turning point in the case, as you have said. So, how was it? How did you get involved in this case?
There is a report in the Indian Express that a patient who died in Lakeshore Hospital, a boy, had been jailed and was certified brain dead and organs transplanted. There were some serious mistakes in what has happened. So the police, the police asked for an inquiry by health committee, district level health committee headed by the Ernakulam district medical officer. But what came in the paper was a comment by Dr. Rema, the forensic professor of the Trivandrum Medical College, a member of the commission. She said, I will not attend the meeting. That signature is not mine. The signature is forged. So the police asked for a state level inquiry committee. So that's how I got it. So then I called for all the postmortem reports, FIRs, hospital records. Then I found everything in that thing was wrong. That is a boy who was admitted in Mar Basilios Hospital with head injury, in which medical terminology we call subarachnoid hemorrhage and subdural hematoma. It's a very simple problem for any neurosurgeon. My medical college, it was done by a general surgeon, not even a neuro, because there are not many neurosurgeons do it. So very simple, put a small balloon and evacuate the clot and the blood. But instead of doing that, he referred the patient to Lakeshore Hospital. Why? There was a neurosurgeon in Mar Basilios Hospital, but they sent the patient without treating to the Lakeshore Hospital. Why? Not for treatment, not for better treatment, but there was sufficient treatment available in Mar Basilios. And in the hospital, while he was in Lakeshore Hospital, no effort whatsoever was done to save the patient. The patient who was in the ventilator was not able to breathe, started breathing on his own. He moved his limbs, which means the patient not brain dead. But they continued not to treat. So they allowed him to suffer brain death or be seriously sick. So what happened was, there are norms for certifying brain death. See, in Kerala we started brain death surgery only in 2012. This happened in 2009. That is the excuse now they made. It was before it came started. But the Act, Transplant of Human Organs and Tissues Act, was in force in 1994. In that it has been specifically said, 4 doctors, empaneled doctors must certify brain death at an interval of 6 hours. And an apnea test must be done. This was not done in Lakeshore Hospital. What they did was, 3 doctors at 3 different times came and looked at the and said brain dead, brain dead, brain. There's a Form 10, which was filled by the 4 doctors simultaneously. This was not done. And these organs, the worst of all, see, if a foreigner must get an organ from an Indian patient, there should not be any waiting list of patients in India, not in the state, in the whole of India. But here, the Malaysian citizen was given the liver out of town.
So this court has taken statements from 2 different doctors, one forensic surgeon and another doctor from Trivandrum.
Yeah.
So
he is a professor of neurology at Trivandrum Medical College.
Yeah. So they were saying that the apnea test was not done.
Yeah.
So why? Like, it's a crucial test, and obviously the doctors, the 8 doctors who gave the certification, obviously they will know that this is the basic thing. They are doctors. So Why would they do that? What would have happened?
They did not expect somebody to scoop it up. Must have happened any number of times. See, this happens in the confines of the ICU, where outsiders are not right. So what the doctor says to what, see, an ordinary patient doesn't know that apnea test has to be done. Now they know because it has come in the news and people know it. But in those days, nobody knew about apnea test.
So every field requires whistleblowers. So do you think that if somebody in the system, within the hospital, or somebody in the system, like have informed about this, like many such incidents would come out, and that we could prevent such things in future?
It's a big lobby. The problem is, if I got government support, and if government supported, the decision based on my case in the High Court, not a single wrong brain certificate would occur in Kerala. The order and the government order and the High Court directly state that the whole thing has a video recorded. So you know that all the 4 doctors are present, and who are whether the 2 doctors from outside are present or not. All tests are being done, whether the apnea test has been done. And there is a regulation that this apnea test has to be watched online by the nodal officer. And after the first apnea test is positive, then only he can order distribution of organs. Nothing happens. And this report is supposed to be the DNA. And there's an expert committee for nothing happens. See, if there is a brain death, it's in the papers. The DMA should know, DMA doesn't know, the Health Secretary should know, he doesn't know. Nobody knows. Not that nobody knows, nobody is bothered to know. If the government took firm steps and said these orders have been followed strictly, there will be no brain death.
So now the organ donation laws are more stringent. So do you think that such a case would happen now, today?
Laws are stringent, but enforcement is nil. Still happening in a smaller scale. Before I went to court, it was 76. It has come down to 9 days here. You know what I mean? If I had not interfered, it must have gone up to 150 by this time. So my case, about 400, 500 patients have been saved from indefinite death. Not a small thing.